Welcome to episode 14 of WooWoo for the Skeptic. I'm Kim Polinder, your host and curiosity advocate for the world of metaphysics. Today we're cracking open the modality of chiropractic. Is it possible that chiropractic is the dark horse of the woo-woo world, historically undervalued and misunderstood by the modern-day medical profession? Did you know that the primary purpose of chiropractic is not for pain relief? If not pain, then what is it good for? Well, stay tuned to find out. Originally, I had not even planned on doing an episode on chiropractic, as my perception was that it just wasn't that woo-woo. Meaning, I thought it was generally accepted as a mainstream form of health management. I've never been to a chiropractor myself, so I was genuinely curious about its holistic approach to health. If you're not that familiar with chiropractic, and possibly a little scared at the thought of getting adjusted, then you will definitely find value in this conversation. So please enjoy. I am so intrigued about our topic of chiropractic with today's guest, Dr. Stanton Hom. Dr. Stan enrolled in West Point, where he studied life science and mechanical engineering. In 2010, he graduated cum laude from the Southern California University of Health Sciences. Dr. Stan's practice specializes in chiropractic, pediatric, and prenatal care here in San Diego. He has a passion and skill set for kids with neurobehavioral challenges, and I'm very curious to hear about his work. Dr. Stan, welcome to the podcast, and thank you for being here.
Hi, Kim. Thanks for having me.
So now you were on the med school track, but it didn't ultimately resonate with you. What drew you to the chiropractic world?
Oh, that's a pretty long story. I was pre-med at West Point, and I did a rotation at Walter Reed, and that's the big Army Medical Center in DC area. And it was kind of an interesting experience. You could just tell there was so much brilliance. Like, I saw brain surgery, I saw open heart surgery, I saw orthopedic surgery, I saw all sorts of things that you rarely get to see as an undergrad. I think I came away from it and I was just like, I didn't really see a conversation. And I think for me, going into healthcare, I always had the idea that I'd love to build relationships. And so I decided to go away from medicine and pre-med. I still stayed in the life science and the chemistry department. Still finished out all the courses, obviously, but I decided that if it wasn't something that I was totally all in for, then I decided that it was probably not the best route to take. Going into chiropractic, it was kind of an interesting experience. Getting out of, you go to West Point and you get slotted to be kind of the cream of the crop in certain respects. And while a lot of my peers at West Point we were all getting out together, upon completing my service, I had, I think maybe 9 out of 10 peers were slotted to go to some sort of Ivy League business school. And I didn't want that. And so my brother was living in San Diego at the time, and he still is, obviously. He's basically lived here since his undergrad. And I always noticed how even just, the 100 miles he'd drive home from San Diego, how relaxed he would be. I always thought, that'd be a nice place to end up at some point. And so that was the only plan that I had. I got out of the Army in 2005 and moved to San Diego, moved in with my brother. And I had about 8 months off. I didn't do anything, in terms of like an occupation or anything like that. And I basically became my brother's roommate. And he was in his second year of chiropractic practice at the time. And I became his patient. And he taught me the whole world of holistic healing, and big part of that was obviously chiropractic, a huge part of that. I learned about yoga, I learned about meditation, I learned about actually physical training in a very holistic way as well, and then obviously nutrition. He introduced me to Whole Foods, and I was like, whoa, like there's a whole market that actually has, an intentional quality of food. And so I think it took me about 2 years. I just loved being a patient. I really did. And I was a personal trainer at the time and kind of just built a small clientele, kept things pretty stable. And then at some point, my brother looked at me. He's like, I think it's time for you to go to school. He's like, you're engaging people about gut health and you're a trainer. And now, it's very common to see trainers talking about, a more holistic perspective. But he advised me then at that point that I should probably go to school.
Yeah, and you mentioned how you had been exposed to a holistic approach to health, and I didn't know that chiropractic was focused on the holistic approach. I, in fact, don't really know that much about chiropractic. I've never even had an adjustment myself. One of my brothers does get regular adjustments, but I think for me and for a lot of people, our perception of chiropractors are, just someone to crack your back and so forth. But can you explain a little bit more about your experience and your training with chiropractic?
Yeah, my experience as a patient, the reason why I was a patient for so long, and obviously I still am a patient, is that 6 weeks into care, I honestly felt like my body hit the reset button. And it was an interesting experience because I was 26 at the time. I left home when I was 17. So I had 9 years of, whether it's the academy or 5 years in the Army or a year in Iraq, I had 9 years of really built up a lot of stress. And it was a really short amount of time, probably 2 or 3 adjustments per week. 6 weeks later, I literally felt I was 17 years old again. It was pretty remarkable. And so chiropractic has this interesting perception. We have this interesting reputation. There's several reasons for that, but generally it's like, oh yeah, it's a kind of a natural therapy for back pain or neck pain. And chiropractic's history and chiropractic's origins are vastly different. A lot of people don't know that the first chiropractic patient, a man named Harvey Lillard, the founder of chiropractic, Daniel David Palmer, adjusted him in 1895. And we kind of have this interesting, like we know chiropractic's birthday. It's September 18th, 1895. And he wasn't adjusted because he had back pain. He wasn't adjusted because he had any physical malady. He was actually adjusted because he let Dr. Palmer know that, at some point he heard a pop somewhere in his spine and his hearing went away. And D.D. Palmer at the time he was so versed in medical literature. He was so versed in magnetic healing. He had this thing called the traveling library that he would take everywhere with him. And at this time, he actually just felt the bones in the spine, felt for misalignment, adjusted Harvey Lillard, and his hearing came back. And what's interesting is that he thought at the time that he had found the cure for hearing. And so he put out these ads, in late 1800s, early 1900s for the cure of hearing. And he had lines out the door and he adjusted all these people. And how many people do you think had their hearing resolved? None. And so the reason is because, and this is something that was kind of troubling at the time, but in reality, it created the paradigm of chiropractic, which is vastly different than the traditional medical paradigm. And what that is that chiropractic actually isn't a treatment. Chiropractic has a fundamental premise. We call it the major premise, and the major premise is that there's a universal intelligence. And in all matter, basically what that means is that there's not one thing that is not made out of this intelligence. And it says there's universal intelligence on all matter that continually gives to it all its properties and actions, thus maintaining it in existence. And everything has, this universal intelligence, is a part of this universal intelligence. But every living being actually has an innate intelligence. And so we kind of have a different supposition than traditional medicine, where if you go to your medical doctor, they ask you a lot of questions about your health history. A lot of times they ask you about family history. And when they ask you about family history, a lot of times they're looking for disease patterns. And they're looking for predisposition. They're looking for genetic markers. And they're looking for, kind of this supposition that the body fails. And our supposition is quite different. These are in the earliest texts. I'm reading a book right now from 1906 that was written by D.D. Palmer's son, B.J. And in the earliest texts, he's basically saying, obviously learning from his father, that if the intelligence in your body, and I think at this point we're about 100 trillion cells or so, right, as adults, if we can make 100 trillion cells out of 2 half cells, then we could probably heal ourselves, right? We probably have that innate healing capacity in our bodies if we can actually, there's really only one way to come onto the earth right now, and it takes 2 half cells. And it's kind of interesting. We have that supposition that healing capacity that builds a whole human is actually that same healing capacity that heals everything. There isn't one disease on the planet that has not been healed by the human body. And that's what's interesting, is that you can literally say, like, oh, you can ask, like, is there a therapy that helps with this? And you can do all sorts of scientific research to do that. And that's so important to do. But from a chiropractic perspective, we say, well, there really isn't a therapy that's stronger than that innate healing. Does that make sense?
Yeah. So then what is the methodology behind chiropractic manipulation then? How does it tap into that universal intelligence for healing?
We kind of look at it very simply. You speak a lot about religion, and I really, really like resonate with your path with like kind of learning about spirituality. And I kind of had not a similar path. I kind of had a blank path and then kind of came into my own in terms of like learning about spirituality. But I've been following the Dalai Lama for a lot of years. One of his top researchers, one of his top advisors is named Dr. Richard Davidson out of the University of Wisconsin-Madison. And he heads the Center for Investigating Healthy Minds there. And what they do is they look a lot at meditation. And they look a lot at meditation and its effect on the brain, and the meditation and its effect on chronic disease. And chiropractic is like, we don't like to overthink it in that we say, well, the brain and spinal cord are the first system that develops in utero. That's why I see so many pregnancies and so many kids. It's like, I love that part of chiropractic. It's the only system that's actually completely surrounded by bone. And so this mind-body exploration that is happening more and more and more at major universities, sponsored by some of the leaders in the world, the top figures in the world, we kind of always have had that as a fundamental tenet, in that, well, if the brain and the spinal cord, connect the brain to the rest of the body, and the only system that's completely protected is the brain and spinal cord, then the spine's probably pretty important. Interestingly, adjusting the spine has several effects. It has a local effect. I kind of break it down into local and global and mechanics and physiology. And locally, you feel better, right? If you have an ache in your back and you actually move a bone and you align that joint, and it's like, whoa, you can actually correct joint alignment. You can actually correct joint movement, and you feel better. Like, you get off the table and you actually stand straighter, right? And the global effect is that every time that there's a misalignment, which we call subluxation, every time there's a subluxation, basically what it does is it changes the mechanoreception in the joints, which changes the physical perception of your body, right? And so I have patients that come in and they walk in, we do a posture exam. And what's interesting about posture is that we're beginning to know more and more, because there's a lot of study going into posture. But posture is a reflection of brain output. It's a reflection of brain perception of your environment, but it's also a reflection of motor output. And so when you get an adjustment, what happens is you normalize that joint, and you normalize, locally what's going on. But what you do is you actually feed into the brain something we call mechanoreception, something that's called proprioception. And what that is it changes the whole perception of your body. And if the mind and body are actually one, then you reestablish that connection, you reestablish that healing capacity.
Are you saying the connection is cut off, or the connection is sending incorrect signals to the brain?
Yeah, it's both. Yeah, so when there's a misalignment or a stuck area in the spine, basically what it does is it cuts off that communication. It interferes with the communication between the brain and the body.
So then the spine isn't really firing on all cylinders if there are adjustments that need to be made?
Yes. Basically, in some respects, what we look at is we look for mobility and we look for alignment in the spine. And if we find areas that are subluxated, areas that are out, or areas that aren't moving properly, areas that aren't coordinated, then it would require an adjustment to correct that joint mobility and alignment. And when it does, then, yeah, that's basically restoring normal motion.
Okay. And so how do people develop subluxations and misalignments?
Subluxations, in my office, I always say spine is life. There isn't really one more prominent physical structure in the body. And for me, I mentor a lot of students. I actually spoke at my grad school a couple weeks ago. And what I tell a lot of students is that, when they graduate, I can feel like their apprehension, I can feel their fear. like when they're actually palpating and feeling the spine, because I always ask students to palpate me. And when I do, what I tell them is that chiropractic isn't just a therapy. Chiropractic isn't just a thing. It's actually life. It's actually you bringing your innate intelligence into your patient's world, and you actually feel that joint. You actually feel the joint, but you feel their life, and you use your life to feel theirs. From the original books of chiropractic, basically they say that there's 3 T's. There's traumas, toxins, and thoughts. And so physical, chemical, and emotional type stressors that are basically our life, and our nervous systems actually perceive that stress, and through that perceived stress cause subluxations, cause areas of the body to actually lock up. And it's kind of like you kind of feel somebody, and if you haven't done chiropractic, you've probably had massage. When you get a massage, do you ever feel like, in some respects, kind of fine, and then you go in and they start feeling your body and you're like, oh, I didn't know I was sore there. And a lot of times, like 75% of the time, it's kind of in your upper shoulders, right? In your traps, in your levator scapula. And what we don't realize is that the fight or flight system in the body, the sympathetic nervous system, the HPA axis, all of that is hardwired kind of into our physical structure, in that if you scare somebody, I always use the analogy of a dog. Have you ever yelled at your dog or cat?
Yes, for barking at the neighbors.
With 2 cats. Like I wonder what my neighbors think sometimes when I'm yelling at my cats. What happens to their posture when you yell at them?
Yeah, they slink down, tail between the legs.
Right, tail between the legs, and it kind of creates this defensive type posture. And what happens is we have that same exact posture. Actually, the reason why I didn't go into corporate America is because I did not want to sit all day. And that posture is basically a defensive sympathetic posture all day long. And so from a physical perspective, absolutely that will cause subluxation. But from an environmental, stressful, emotional stress type perspective, it's actually hardwiring you to do that. Go ahead and slouch. And when you slouch, like really, really, really get low and try to feel like the emotion of elation. Like, does it feel weird?
Yeah, it's hard to access that in that position.
Yeah, and then sit up tall, get into good posture, and then take a few deep breaths, and then at the same time, try to feel depressed. And what I find in my practice is that when I kind of tie people in to that, it's kind of a very practical and very simple way of saying, hey, the body and mind are totally connected. And the body and mind are totally, actually, if we get further down the road, they're actually one, right?
Yeah, so let's say you have a childhood where you are criticized a lot, you get into the slinking down position a lot, and that pattern is kind of set energetically. Now, if you get that patient as an adult, can you reverse all of those years of patterning of the slinking?
It's kind of interesting, because of our reputation, most people with emotional histories, emotional trauma, they wouldn't first think about going to a chiropractor. To answer your question, absolutely. I think that's one of the primary goals of chiropractic is actually helping with structure, right? We do have a fundamental principle that says that there are absolute limitations in matter. And so every structure cannot be transformed into ideal per se, but you can absolutely do your best. But what I would say is that it's kind of a tragedy that we don't think about chiropractic. And it's because of that exact reason. How could you? If you don't have sound structure, how could you actually have your full potential in terms of your emotional intelligence, in terms of your emotional resilience, or actually healing from a lot of those histories, right?
Is it fair to say that certain types of emotions are going to manifest in certain areas of the spine consistently, or does it just depend on the person?
Chiropractors are totally wacky. In our profession, I think we have over 300 techniques. And not all of them are just for the physical body, right? And there's a technique that I was trained in a long time ago. I wouldn't say it's one of my primary techniques, but it's called NeuroEmotional Technique. It was developed by a man named Scott Walker. And this guy he's such an incredible, he's just such a weird dude. So many chiropractors are weird dudes. Like he used to, when I used to see him at conferences, he'd always wear a purple beret and a giant white beard, and he looked like Santa Claus, right? And so he actually developed a technique that actually incorporated a lot of acupuncture, in that every area of the spine innervates, orchestrates, communicates, integrates every area of the body. There isn't one area of the body that is not stimulated by neural tissue, right? What's interesting about Scott is actually he, based on Chinese medicine theory, organ systems have different emotional signatures, right? The lungs are grief and sadness, right? The gallbladder is very gall. There's a lot of frustration. And so because different areas of the spine actually correlate and coordinate with those different organ systems, they absolutely can present in specific areas of the spine. Would I say it's 100%? No, I wouldn't. I would say that there's a lot of variance. Even the best anatomists in the world will say that even Netter's Anatomy, the book, is about 60% correct. I would say there is some variance, but you can apply it in certain respects, absolutely.
And when you take something like, back pain in general is such a common thing, especially lower back pain. How much of that have you found is related to the spine versus muscle?
We get that a lot, right? I think I actually just need a massage because it's actually just muscle, right? And what's interesting, it's like, I don't know how patients know that, but I hear it over and over and over. And what's interesting, chiropractors would say, like, the only reason why you feel it in your muscle is because you have mechanoreceptors and proprioceptors in your muscles sending those signals through your brain through nerve tissue. Pain is actually not felt. It's felt perceptually in the muscle, but the actual stimuli of nociception, which is pain signals, the actual pathway of pain, is called nociception in the body. And it actually is not ever felt until it's in your brain. I would say that in terms of things being actually mechanical, I don't know the percentage. I wish I did, but I don't know the percentage. But what I do know is that anytime that there is a perception of pain or there's something off in the low back, whether it's mechanical or not, it needs a thorough evaluation of what's actually going on. Because a lot of times you go to a physiatrist, you go to your GP, you go to anybody, a lot of times they'll just give you something to make you feel better. And we kind of use the analogy of painting over rust, right? It's like your check engine light is going on, or your gas light is going on. You kind of just put a piece of tape over it and you kind of just go on with your life, right?
So can you break down a few of or give some examples of how different areas of the spine might be related to disease or emotional problems or anything like that?
Sure. I'll give you an example. I think we've seen hundreds of babies at this point. Every time I see a mom for prenatal chiropractic care, I offer my infant exam complimentary. And I offer it complimentary because I have this belief that every baby should be checked. I think every baby should be checked by a properly trained and qualified chiropractor, pediatric chiropractor. And I would say upwards of 80% of them have some sort of subluxation pattern in the upper cervical spine. What I find is that has a relationship to something mechanical, say, like having a torticollis. Torticollis is basically an asymmetry in the positioning of the head, right? That's a slight head turn. It's like a slight head tilt. And I find that in a very minor form, at least 80% of the babies too. So mechanically, there's a relationship, right? I would say upwards of 70% of the patients, the new babies that are referred to me, they're actually referred for breastfeeding challenges. And so a lot of times, there's a checking of a tongue tie. There's a checking of, whether or not baby can open its mouth. And there's a checking of like stuff actually in the jaw, checking a palate. And what we find is that if there's slight immobility, if there's a slight asymmetry, or if there's something going on, it could actually change the entire biomechanics of the jaw. On one end, this can lead to breastfeeding challenges. Obviously, baby might not transfer milk, might not make it comfortable for mom and baby to actually nurse. Mom and baby might not be able to have actually a good connection. And so what happens on the tail end sometimes is we find a relationship to digestive challenges, and we find a relationship to colic. we find a relationship to ear infections, right? And all this actually stemming from the upper cervical spine. And the reason is because the upper cervical spine has a completely, and I mean, they might as well be one and the same, but has a completely intimate relationship with the cranial structure, right? And the cranial structure being able to be balanced and being able to move properly actually would integrate into the jaw. All those soft tissues are totally connected. The upper cervical spine, the atlas, the top vertebrae in the neck, if it's out of alignment, actually can stretch or tighten or pull a muscle called the tensor veli palatini. And that muscle has a direct connection to the eustachian tube. And so one of the primary reasons why babies are evaluated by pediatricians or pediatrician visits or ER visits is actually ear infections. And so on one end, it's a compromise in the immune system, right? On another end, it's potentially a mechanical derivative in terms of having a torticollis or an asymmetry in head positioning. On another end, it changes motor output, meaning babies have an interesting ability or inability to latch on a mom and actually get efficient nursing or comfortable nursing for mom, or actually even, that psychological connection with mom. And that's all just kind of stemming from the upper cervical spine.
Now, with these challenges in infants, is that something that they get through the act of childbirth, that it's traumatic somehow to their body?
Yeah, if you ask any mom, they'll tell you that it's traumatic, physically, mentally, emotionally, spiritually. It's the most significant event in, all species on the planet. On one end, that transition is a huge factor, for sure. Babies being born, whether it's actually through the vaginal canal or through cesarean section, there is a significant amount of pressure. If you've ever seen a video, you just look at a baby's neck and you wonder. And so on one end, it's that, but it's also in utero. Everyone always asks me, when's the best time to go in? When's the best time for prenatal, your first prenatal chiropractic visit? And one end, we say, sooner the better. I love doing first trimester evaluations because we can actually see postural asymmetries that would potentially affect baby position down the road. But then at the same time, by the time you're in third trimester, by the time moms are in third trimester, a lot of times babies are pretty set, in terms of positioning. I'm sorry, not third trimester, but typically 36 weeks or so. When that's the case, a lot of times just a slight head tilt one way or the other will actually determine whether or not baby can actually scoop their jaw, can actually release the jaw and get a good pull. And then a lot of times it will determine whether or not the latch is very chompy, and bitey. If you ask moms who are breastfeeding, that's usually what they complain about.
So you're talking about adjusting the mother in order to make childbirth as smooth as possible?
What's interesting is that a lot of the research that is, in prenatal chiropractic care actually shows that, one, we reduce interventions. We reduce whether, a lot of times the number of procedures that are done, the number of, drugs that are given. A lot of times we reduce labor times. And a lot of times we increase comfort pretty significantly. And obviously there's certain pain patterns, pubic symphysis dysfunction, coccygeal pain, low back pain, sciatica, a lot of that stuff actually improves as well. But really the big goal is to see if we can actually improve the experience for both mom and baby.
And then for babies who do have challenges with breastfeeding, some friends of mine just had a baby and they did go through some challenges in the beginning. Would it be an adjustment on the baby, like spinal adjustments that you'd be doing?
Yeah, I would say that's probably one of the number one procedures to do that's beneficial for babies that are having breastfeeding challenges for sure.
Okay, and I know you also incorporate some energetic work, like a little bit of CST, is that true?
Yeah, you know what? CST, I'm not formally trained per se, but my brother was trained by a pretty amazing North County chiropractor, and my brother handed a lot of that down to me. And so there's a lot of cranial-sacral approaches that I use for sure to help babies.
Just as an overview, what's the methodology behind cranial-sacral?
There's a similar chiropractic technique called Sacro Occipital Technique. And the reason why the sacrum and the occiput and the cranium and the sacrum are so important is that the body's kind of broken down into two systems, right? There's two autonomic systems that affect physiology. And one is a sympathetic fight or flight, and the other is the parasympathetic rest and digest system. And the cranium and the sacrum house very strong and influential inlets into that parasympathetic rest, digest, healing, relaxation system. And so the theory behind cranial-sacral and Sacro Occipital Technique is that there is that aspect, that actual physiological aspect in terms of where the parasympathetic system is housed, but there's also an aspect that the cranium, the brain creates cerebrospinal fluid, and the cerebrospinal fluid is what kind of bathes and nourishes and cushions and heals the entire nervous system. And it basically gets pumped, through the ventricles in the brain, all the way down the spinal cord, all the way through the sacrum, and all the way back up. It creates something called the cranial-rhythmic pulse. And the cranial-rhythmic pulse is basically that flow. And that flow of cerebral spinal fluid is something that you can feel I don't know how my teachers described this, but they basically said something like, you're going to feel like you're lying to yourself. You're going to feel like you're not really feeling anything at first, because you're trying to feel this actual pulse. Like you can feel your carotid artery and you can feel your pulse, right? And a lot of times you can't feel that. A lot of times it's just an energetic pulse that's actually sometimes asynchronous, sometimes it's synchronous, and a lot of times you can feel whether or not something is actually balanced just by feeling for that rhythm.
And then what would you do to fix the rhythm?
Basically what you do, and what I do on probably 80% of the babies, is actually feel underneath the occiput, is actually have my entire hand on their skull, and then my other hand is basically like cupping their sacrum. And a lot of times what you can do is, one, you can just assess to feel if you feel synchrony. You can assess to feel if you feel asynchrony. If you can feel, a lot of times you can feel the ends of the spine and you can feel tension throughout the body. And so a lot of times it's different motions at those ends of the spine. You can distract the spine, which means make it longer. You can flex it one way or the other, right? You can flex, the baby into lateral flexion, or, lateral flexion to the left, lateral flexion to the right. You can actually rotate a little bit. And a lot of times, just by feeling what's going on in that motion, you can actually release a lot of that tension in the body, and you can actually cause that energy to flow normally.
So can you give some examples of clients who have benefited from your combination of chiropractic and energy work? Or are there any themes of clients that come to you? Like, do you have a pattern of problems that you typically deal with more often than not?
So in our practice, we have generally three categories. We see a lot of our patients are preconception prenatal. A lot of them are pediatric, infant all the way through 18 years old. And then we have the mere mortals. I call the adults the mere mortals. And so I'll kind of give you a synopsis for each of those categories. What's interesting is I would say 80% of our prenatal visits are referred in after 36 weeks. Whether it's breech presentation or transverse presentation, what's very common is that if it's not breech or transverse, sometimes it's just baby isn't in the best position, right? And so with breech and transverse, we use the Webster technique. The Webster technique is interesting. It's the primary prenatal technique in chiropractic, and it actually brings together maybe 14 different techniques. And what's interesting is that it's actually one of the lowest force techniques in chiropractic. It takes into account Sacro Occipital Technique, which we talked about a little bit before. It takes into account a technique called Logan Basic, which was developed out of the school in St. Louis. And that technique is literally just like a contact on the sacrotuberous ligament, which is the ligament that goes between the ischial tuberosity and the sacrum. And you contact that ligament and you feel energetically for tension throughout the rest of the body. Most of the techniques in prenatal chiropractic care are so low intervention, they're low force. And the reason is because there is no real, outside of infancy and early childhood, we don't have like as dynamic of physiologies. And so very little force and very little intervention can actually have a profound response. And so in many cases, it's not 100%. I would love it if it were. But in a lot of respects, we have babies turn. We have babies that get into optimal position just by getting evaluated from a chiropractic lens, a prenatal chiropractic lens, and then using the Webster technique to create balance in the body, which then the baby kind of has that inborn intelligence just like mom does, and baby finds that right position. So that's one aspect. With kids, a lot of the kiddos that we actually have with brain challenges, a lot of times we can find these rather early. If a baby has an interesting asymmetry in hearing capacity, or the babies that are going to speech pathologists and are actually having a little bit of delay in speech, kids that have like some sort of tendency for seizures or epilepsy and things like that. All of these are, in many respects, helped very considerably with chiropractic. And when they have an origin in the brain, a lot of times what you'll find is that pediatricians and pediatric neurologists, they'll do a lot of tests, they'll do MRIs, they'll do EEGs, and a lot of times they'll find that everything's normal. And the reason is because a lot of times they're looking for something called hard lesions. They're looking for tumors. They're looking for actual masses. They're looking for actual change in the actual structure of the neurology of the brain. And what chiropractic is pretty magical at doing is finding soft lesions. And soft lesions are things that actually don't show up on imaging. Chiropractic for kids and babies is pretty remarkable too, because a lot of times moms will say, like, that's it? And you're like, yeah, babies don't need a lot. Kiddos don't need a ton of adjusting in a lot of respects because their physiologies are super dynamic too.
So are mothers bringing you babies with any sort of issue in mind, or is it just for a general checkup?
I would say a lot of the moms that see us first, in terms of prenatal care, a lot of times because we offer the infant exam complimentary, they bring babies no matter what. And they bring their babies just to get checked and see if something's going on. And a lot of times they'll say, this baby's not sleeping very well. The baby doesn't seem to know night and day very well. This baby's not eating as much as, baby's not gaining weight appropriately. And so a lot of times they won't make the connection that there is a connection between chiropractic and the structure of the body and the function of the body. But all the babies whose moms have not seen us yet, most of them have something going on.
Generally, how many sessions does it take to get the child into a healthy, functioning state?
A lot less than adults, I'll tell you that much for sure. They generally don't have the decades of stress to work through, right? I do my first appointment and do a thorough functional neurological exam. I do a good postural screen. Even on babies, you can actually see a lot of postural tendencies and a lot of asymmetries, a lot of basically check every joint in the body and actually see how it moves. I'll actually do a couple measurements on our computer too, where we do infrared thermography along the spine, and we can actually see how blood flow and inflammatory changes actually might be affecting baby too. From there, typically, depending on what we're actually seeing in the exam, will determine the actual course of care. And so a lot of times, symptoms aren't always the best way to determine whether or not. How many visits, how often, how much, et cetera, et cetera. Usually we rely on the history and the exam. But I would say I like to see babies twice weekly, and I like to see babies twice weekly for about 8 weeks. I like to see them for about 8 weeks because that's usually when we can see good, sustainable neurological change. I think there's a lot of research on building habits, and changing habits and things like that. And a lot of times they say, you wonder why so many cleanses are like 21 days or 28 days, et cetera, et cetera. It's because there's a certain amount of change that happens just by repeating patterns, right? And so if we see an asymmetry and we start to align it, usually it's twice weekly for about 8 weeks, but it depends. It really depends on, the uniqueness of each.
And is chiropractic for anyone, or are there any people or situations where it's generally not recommended?
I'm super biased because I'm a chiropractor, but I would say that if you have a spine and if you have a functioning nervous system, that you should probably get checked by a chiropractor. because there are 300 different techniques, literally, like in chiropractic, like you can actually find a chiropractor that could fit your needs. Some are super energetic, super low force. Some are purely emotional based. Some are so old school that when you get adjusted, you feel like your thoracic spine went through the table and onto the floor. And you're like, wow, like that did something, totally did something. And so in terms of like the vastness of the techniques available, like really you could actually get evaluated and actually probably get great care from some chiropractor, depending on the technique and depending on what suits your comfort.
Okay, so yeah, it's just a matter of researching who's out there and what chiropractor is going to fit your needs. Like if you want someone who's into energy, who works with children, prenatal, newborns, you would be a perfect fit for them then.
Yeah, it's kind of interesting. I think every NFL football team has a chiropractor. You see more and more, top athletes. One of my mentors is the chiropractor. He got flown out to London for not the most recent Olympics, but the one before, and actually got to watch his athlete play. And there's the whole Olympic medical team. Actually, I think the top physicians on the Olympic medical team are actually chiropractors. And so there's a whole sports med realm of chiropractic. There's prenatal, there's all sorts of specializations that make it available for everybody.
And what would you say to skeptics who don't believe that chiropractic is worth the effort?
I'd say you're listening to old messages. I think I just read today, I was reading through one of my teacher's websites, and he goes through the history of chiropractic. And I think as early as its inception, because so many medical doctors and osteopaths went into chiropractic school and then immediately started developing their own techniques afterwards, and opening their own schools and whatnot. But as soon as the medical industry knew that they could, have a monopoly on the entire system, I think they actually were found guilty in the 80s for illegal boycotts against chiropractic. And so a lot of even the term quackery was developed because the AMA, the American Medical Association, actually created a commission on quackery. They were going to call it the Commission on Chiropractic, but they thought that was too official. And so they called it the Commission on Quackery, and their goal was to contain and eliminate chiropractic. They would give new graduates these things called quack packs, and they would brief them on, hey, some of your patients will tell you that they went to a chiropractor and they got helped. And sometimes they describe chiropractors as rabid dogs, and charlatans and all sorts of, the different perceptions. And so a lot of the skeptics today, I think, might be, on the coattails of some of those older perspectives. But for those that are just skeptics, those that are just critical thinkers, I'm a critical thinker. I'm a scientist. I'm an engineer, by training. And for me, largely, it's then just read. There's a book. My favorite researcher in chiropractic, her name is Dr. Heidi Havik. She's the director of research at the New Zealand College of Chiropractic. And she wrote a book called The Reality Check. And she is, I think, over the last, greater than a decade, has been showing chiropractic care's influence on brain function. And what's interesting is that she put it into a layperson's book. I think it's $35 or something like that. And so for me, I give that to every one of the students I mentor. And I give it because they have to have the understanding of the gravity of chiropractic. And for those who are skeptical and who love to read and are actually looking for, kind of to advance their knowledge in things, then I would direct them there totally. I would direct them to Dr. Havik's studies, because she actually, from a chiropractic perspective, is developing research that is totally in line and totally in line with our original tenets, and then at the same time totally in line with the gravity that the original chiropractors saw the profession. The purpose of the profession was never really just about pain. It was never about just feeling better. It was about potentially, you read the oldest books and they actually talk about chiropractic having an influence on changing the world.
Why do you think it was that the medical association was so threatened by chiropractic?
The true tenets of chiropractic say that chiropractic is not a therapy, right? We're not treating illness. What we're looking at is imbalance in the body, and we're actually creating a situation where the body's healing capacity can be optimized. And there's an organization called the Institute of Noetic Sciences. Noetic is like spiritual sciences, right? If you look up their website, they have a resource. It's a pretty amazing resource. It's a book on all the peer-reviewed published spontaneous remissions, right? So spontaneous remission is like, you know what, you have stage 4 cancer and miraculously you're healed, like there's something remarkable that happens. And they have a book, it's thousands of pages long, of all the peer-reviewed spontaneous remissions of virtually every illness. Like you look at it and you're like, holy cow, there's so many crazy things in here. And it's like, wow, that's in a medical journal, right? And so chiropractors, I think we've been faced with that because we've been so staunchly against what we call, it's basically a medical monopoly. We have this completely opposite perspective of health freedom, and that you should have a full freedom to choose, your healthcare provider. And then at the same time, you should be, as soon as you're put on any therapy, there should be some sort of path off the therapy, right? And for us, we think I know we receive so much heat from the political medical agenda because very classically, I didn't go into the mere mortals, right? But very classically, I have patients that come in on 14 medications, that have several comorbidities, that have several chronic diseases. And a lot of times I'll tell my patients, I'll say, give me a year. Give me a year to work with you, and we'll see. We'll look back a year from now and we'll say, holy cow, like that was a different year than my previous 30. My poster patient right now, he's a 63-year-old gentleman. Love this man to death. He's 39 years in the Air Force. We kind of have that military kind of brotherhood, right? And he came to me a couple years ago, and we just celebrated our 2-year doctor-patient relationship. And we go through like his first initial assessment, 14 medications from asthma to cholesterol to diabetes to all the way down the line, 14 other medications. And basically, he was a hip surgery consult, and he was being evaluated for PTSD. And a year later, we look at his scans, and his scans look almost completely normal, the functional neurological scans that I do in my office. And it's shocking to people because a year later, he's 35 pounds less. He no longer has hip issues at all. Like, he was a hip surgical consult. They were literally getting him, ready for surgery, like in the next couple of weeks before he saw me. And he has 0 medications after that first year. And that is, to the medical complex, that is like the worst enemy, right?
That would be a serious threat for sure to the pharmaceutical industry.
And so that end of that first year, his life completely changed, absolutely. But you know what? When I talked to him literally 2 weeks ago, he's like, you changed my life. He's like remarried, and his whole life path was completely changed. And the joy and the peace and the inspiration and all those other like yummy aspects of life that are totally non-existent when you have 14 medications in your body, right? Like the fact that we get through that first year and he's out of pain, he's asymptomatic, he's feeling great, he's 35 pounds lighter, that's awesome. But that's when we just get started. So where medicine ends, like we're just getting started. If you're in any sort of therapeutic realm, you're working and reacting to something. But once you get asymptomatic, once you get away from a lot of those, competing problems in your body, you actually can breathe, 1, but 2, that's where your foundation, you start to build for lifetime sustainable wellness. And that to the medical community is crazy. Like that's not even a concept that they understand.
And for anyone who may fear or have fears around getting adjusted, having your neck cracked, if that's even a part of it all the time, what would you say to alleviate those fears or concerns?
I'd say number 1, tell your chiropractor. Absolutely. Like if you make an appointment, tell them right away, because a lot of times we have a primary technique, right? And a lot of times chiropractors, especially in the really fast-paced practices, a lot of times they don't recognize those apprehensions right away. For me, I always ask, I always engage the patients in those types of conversations. I basically take patients through range of motion. I'll say, hey, an adjustment is like 1% more of that, and they're like, oh, really? That's it? A lot of times there's this perception that they're going to get Jean-Claude Van Damme style, or like Steven Seagal style. And in some practices, you might, not obviously breaking your neck and things like that. But a lot of times I go to these, some of my best mentors, I love getting adjusted by them because they teach me like the range of which you can move a body safely, right? Largely, if you look at the safety data in the peer-reviewed medical research, a lot of times what happens is chiropractic gets blamed for the errors of other people. I've read a peer-reviewed research article that says, chiropractic injures, chiropractic kills, and you'll look into the article and you're like, oh, that was a barber, that was a soccer coach, that was a karate teacher. Like they weren't even chiropractors, but they get labeled as chiropractic adjustments, right? But if you look at the data, the number one data to understand in terms of safety is malpractice, right? I'm in my 7th year of practice, and my malpractice is like $150 a month. I don't even think acupuncturists are that low. I'm not sure, I'm not 100% positive. But you ask any medical doctor what their malpractice is. They may not know because their hospital might take care of it. If you look at malpractice, we have literally the lowest malpractice in all, actual qualified healthcare interventions. And so I'd say largely we're the safest, even though we have an interesting reputation.
Yeah. Well, I really want to thank you for clearing up a lot of things. And it was very interesting to hear how pain is not even one of the top reasons to get chiropractic work done. Yeah, the whole energetic aspect and the emotional aspect was very enlightening.
Thank you. I think the world would be a completely different place if the model of healthcare was through the lens that we actually look through from our original tenets. Yeah, I think one of the things that's very, very simple is that everything in traditional healthcare, in the allopathic paradigm, regardless, is reactionary. There's no prevention in allopathy. Whereas in chiropractic, a lot of times we say, yeah, let's get you asymptomatic because then we can actually work on building the life that you want.
Yeah, definitely.
Absolutely.
All right. Well, Dr. Stan, before I let you go, I was wondering if I could ask you a few fun questions to get to know a different side of you.
I was going to prepare for this. Oh my gosh. I listened to your podcast. I was like, oh, I'm going to be ready for those. And I don't even remember them now. So this is going to be...
All right. Well, the first one's easy. What was your favorite music group growing up?
Oh, you know what? I was kind of an R&B type guy. I got that from my dad.
Oh, really?
He loves Motown. And so mine, maybe a little bit embarrassingly, was Boyz II Men.
Oh.
Yes.
I liked Boyz II Men growing up. I don't know. I think we might be around the same age, but yeah, they had a good sound.
Super funny.
Yeah, good choice. And they always dressed very...
They always dress nice. And
coordinated, yeah.
I love a cappella. I love if you sound good with no editing, I love hearing that kind of talent.
Oh, me too. Yeah, the harmonizing and for sure. All right. Well, the second question is, did you have a crowning achievement in middle school or something that you were proud of?
I love this question. This is why I love seeing kids that are kind of told that they're ADHD or they have learning problems or something like that. I got a D- in pre-algebra. And coming from an Asian household, that does not happen. You do not get a D-, right? You don't get a B, let alone a D-. And so my teacher was so concerned about me because I would do all of my homework. I would specifically need 0.5 pencil lead because I would write all of my homework in one line of college ruled paper. And I would write everything out, but it would be so tiny that nobody could read it. And so my crowning achievement was going into my teacher's parent-teacher conference because I got called in because I was apparently cheating. I went in and I told my teacher, I was like, no, like I know all of the answers. Like this class is so easy for me. She's like, no, I think you're cheating on the test. And I told my mom, I was like, no, I know actually all of it. Like there's not one thing that I have a question on. Like was always really, really good at math. And so a lot of times what I find is that teachers are so busy, they're busier than ever. And I find that they kind of mislabel kids, and they kind of have a different idea of what's going on with these kids. So when these kids come to me, in a lot of respects, I can see and uncover what's actually there. I have no idea to this day why I did that. I don't know why I would write my homework in one line, but I do know that as I look back, that's a huge crowning achievement, because it means that I can like literally sometimes see through the layers of stuff that kids are dealing with, and see what's actually at the core and help them heal.
Yeah, that's funny that you mentioned about being Asian. My niece and I used to watch Glee back when she lived with me for a little bit, and one of the jokes on the show was that getting an A- was an Asian F. So we just got a kick out of that.
Yeah, like you got a 90, I got a 97. Where's the other people? Like, oh, yeah, that's.
Yeah, exactly. And then lastly, what is the number one thing on your bucket list?
To meet the Dalai Lama.
Oh.
Like I got to hear him speak last year in Orange County, and I read the first book that I ever read of his was called Ethics for a New Millennium. I read it in 1999, and I read that book and I was like, holy cow. Like it was almost like my grandpa was speaking to me. It was like my grandpa on my dad's side, my mom's side, literally no words. Like my brother and I, we just gave the eulogy at my uncle's funeral. And one of the things my brother said is like, things like I love you, we never said them. Like they just never came out, It's interesting. Like I read the Dalai Lama's book and I was like, that's what we were taught to be, in terms of like Buddhist philosophy, in terms of Buddhist principles. We weren't brought up Buddhist at all. But interestingly, when I read that book, it sent me down a path that still continues to this day. Like I would love to meet him one day.
Yeah. Wow. That would be amazing. All right. Well, Dr. Stan, if listeners want to contact you for pediatric or prenatal care or any other chiropractic sort of care, what's the best way to find you?
I would say our website is changing. We're actually changing our practice name to, we're going to call it Future Generations Center for Healthy Families. But that website isn't up yet. So if they just Google my name, our website is drstantonhom.com. And we're on Facebook as well. It's super easy to find us, and we always make time for new patients and whatnot. So absolutely, those are the easiest ways.
All right, wonderful. Well, thanks again for spending time talking with me today, and I wish you the best in your practice going forward.
Thank you so much, Kim. I really appreciate the time. You're a wonderful interviewer.
Oh, thank you. For this week's WooWoo News Corner, I found an article that referenced a 2011 study on the effectiveness of chiropractic on neck pain. Researchers at the New Zealand College of Chiropractic explored whether spinal manipulation could restore the communication between the neck and the arms. Study participants with a history of neck pain who performed poorly in the initial tests significantly improved their ability to accurately position their elbow joints after the chiropractic treatments. Researchers found that their movement significantly improved after just one treatment. The study went on to conclude that chiropractic treatment can be helpful in restoring neurophysiological connections throughout the upper body. Thank you for listening to WooWoo for the Skeptic. I would love to hear from you if you have ideas for a show or want to give feedback on an episode. And if you enjoyed this episode with Dr. Stan, please share it with your friends. And now for your moment of woo. This quote comes from Dr. Joe Kosterich, who said, "The mind and body are not separate. What affects one affects the other." Have a great week, everyone.